Hope you all are having a good virtual day. Today we are going to go over some muscles, and you're going to need to learn a few of them that will help you in moving forward as we start foot, ankle, and lower leg injuries. We move into knee and hip injuries and then upper extremity injuries. So there's over 600 muscles in the human body. We're only going to talk about a few of them in class. Three different types of muscles, which we did talk about in previous lessons, but we have skeletal, we have cardiac, and we have smooth muscle. Our skeletal muscles are the muscles that we're going to talk about today. Those are the muscles our arms and legs, biceps, triceps, quadriceps, hamstrings, things like that. The cardiac muscle is the heart, and smooth muscles, the muscles of the digestive system, the esophagus, the stomach, and all of the intestines are smooth muscles that work automatically. Skeletal muscles, big difference is they are voluntary. Our brain, we can consciously control those movements. How do we move muscles? Muscles work by changing length. So I have a little example here today. This is a bicep. So when this bicep, let's straighten it out. When this bicep contracts or changes length, it shortens. That is when it flexes. So this is elbow flexion. The bicep is contracting here. So muscles work by changing length. The bicep is long here, and then when the bicep shortens, it pulls your lower arm up. So muscles work by changing lengths. Muscle fibers are stimulated by nerves when they contract or shorten. So this would be a bicep contraction with this movement here. Bicep contract, which flexes the elbow. And the next one, muscles can only pull bones. So see how this bicep, it is pulling up. So we have a muscle on the back here, which is our tricep, is going to pull back. Muscles can never push, they only can pull bones. Antagonistic muscles work in opposition to each other. So for this example, the bicep and the tricep work antagonistic to each other. There are lots of synergistic muscles in addition to the bicep that help with elbow flexion and help the tricep with elbow extension. So that's antagonistic muscles work in opposition of each other. Biceps and triceps, your serratus anterior and your rhomboids. We're going to go through a series of muscles here. You have some notes that you need to write these down on. It's just the slides and you need to fill in the blanks. So the first one is deltoids. Your deltoids are your shoulder cap here. You have your anterior, posterior, medial deltoids. So 3 parts there. I remember it like if you put your arms out using your deltoids here, like Delta airplane, your deltoids are right here. Deltoids allow for lateral arm raises. So that's shoulder flexion and arm abduction. The serratus anterior muscles, these allow for shoulder protraction. So remember, protraction is moving forward. If you were to put your arms against a wall here and then you were to push further, that's going to be your serratus anterior that you're engaging there. It works antagonistically to the rhomboids. Your rhomboids pulled your shoulders back and together. They're between your scapula. So serratus anterior, shoulder protraction, moving forward. Remember, protraction is moving forward. Biceps. Your biceps are on the front of your upper arm and allow for elbow flexion. As you saw in my diagram here, this is the bicep muscle that contracts or shortens, and it flexes the elbow. Elbow flexion. So biceps, elbow flexion. The next one is triceps. Triceps are on the back of the upper arm, and triceps allow for elbow extension. So like extending a hand to help somebody. Extension. The pectoralis major, there's pectoralis minor, other muscles, but the muscles of the chest, when we're doing our push-ups, so this is horizontal adduction of our arms. That movement there, which we do in the push-up, when we do a push-up, that is using your pectoralis major muscle. Chest press, bench press, all those are other examples. Your rhomboids, when you do the rowing motion, row, row, row with your rhomboids because you're pulling your scapula back and together. You can see them right here between your scapula and your vertebral column, which they attach in here, and they shorten or contract and pull the scapula back and together. Rectus abdominis. This is the long muscle that runs from your rib cage all the way down to your pubic bone. It's the rectus abdominis. When we do sit-ups, we're working our rectus abdominis. People they want to have 6-pack or an 8-pack, their abs. This is the rectus abdominis muscle that you can see. Trunk flexion is the motion. Obliques. I remember this by putting my hands on my sides and going, oh boy, your obliques are on the sides of your abdomens right here. Oh boy, obliques. Your obliques allow for rotation of your trunk. Trunk rotation. Your transverse abdominals, this allows for lateral flexion, so bending to the side. We do pickpockets in body sculpting class. We do a lot of ab stuff. These are transverse abdominals, and they are sit right here on the sides of the abdomen like you're putting your hands in your pocket. They run this way, and then they run that way. Transverse abdominis, transverse abdominal muscles. The gracilis is a groin muscle. It allows for hip adduction, so bringing the leg, adding it back to the center line. Hip adduction is the gracilis, is a large muscle of the groin there. The adductors, this is a group of muscles that you don't have to learn the individual names of the adductors, but the gracilis is one of them. But the adductors here is a group of muscles that allows for adduction, hip adduction, so bringing the leg back towards the center line, adding it back. The sartorius is the longest muscle, and it crosses your hip joint and it crosses your knee. If you were to sit in a chair, I think I can skip back far enough here, but from a chair, if you cross your legs, so you're flexing at the hip and you're flexing at your knee, then you are using your sartorius muscle. There's 4 actions there when you're crossing your legs. Flexes, laterally rotates the thigh, and leg flexion. Sartorius, the longest muscle. Hamstrings. Hamstrings are a group of muscles, and you can see here the bicep femoris, the semitendinosus, and the semimembranosus are the 3 muscles that make up the hamstrings. For this class, you only need to learn that is the hamstrings. Hamstrings do knee flexion. Next one is quadriceps. Quadriceps are on the front of your upper thigh, right here. It is a group of 4 muscles. You can see here the rectus femoris. The vastus lateralis is on the outside. The vastus medialis and the vastus intermedius. So your medialis, this is the VMO, is what it's called, vastus medialis oblique. But 4 muscles. The rectus femoris, you can see here on the lateral side there. Knee extension, so extending the knee. The next one is trapezius. The trapezius is a muscle that attaches here to the spine and then out here. It allows for shoulder elevation. You probably call it traps, shoulder raises or shoulder shrugs. The next one is latissimus dorsi. Latissimus dorsi is a large muscle in the back here that allows for arm adduction. So if you ever, you're at the gym and you sit down at the machine, we don't have one here at North, but there's a bar up here and you sit down, you reach and grab the bar and you pull it down and back. That's kind of that's the arm adduction. It's called the lats pull down machine. You're working your latissimus dorsi with this machine, but it's arm adduction, bringing your arms closer back to your body. Gastrocnemius is the next one. The gastrocnemius is the bunchy muscle up here. We'll talk about the soleus next, which is a little deeper. The gastrocnemius is more superficial than the soleus, but it's the bulky part of the calves. Doing calf raises, which we know is called plantar flexion. The soleus, again, works with plantar flexion. It is deeper to the gastrocnemius. These muscles attach down into the Achilles tendon. The tibialis anterior is on the front of the shin. It allows for dorsiflexion of the foot at the ankle there. If you are getting your ankle taped, we tape in a dorsiflex position. So your anterior tibialis could cramp if you're not used to holding it in that position very long. So dorsiflexion, pulling the toes up. The gluteus maximus, there are other glute muscles. But just for this class, the gluteus maximus is the only one you need to know, and it's hip extension. So hip flexion is going to look like this. Hip extension is there and back. And those are the glutes. All right, that is the last muscle for today. Make sure you have your notes filled out. There will be a quiz over the muscles shortly. Pay attention in class and see when that will be for your class. I hope you have a great virtual day. We'll see you tomorrow.